Hey, can you hear me okay?
Yes, I can hear you. I didn't have my mic on.
Okay. How you doing?
Pretty good. We just had a fire alarm, so that's a lot of fun, but we're back in the building now, so that's good.
I'm glad it happened now.
I wonder if yeah, instead of in the middle, I wonder if I need to change my background if I can. Ah, doesn't give me the option to do a blur. Okay, so I guess it will just be
Did you look on your video?
oh, I gotta um
Hey, Kyle. Oh, you're on
yeah,
mute.
interesting. Okay. Yeah, no, it doesn't give me the option, so that's fun.
Huh.
Oh God, that's bad.
I'm gonna pause recording.
Okay. Are we gonna get started?
Yes.
Perfect. Carly, would you mind sharing your screen? Thank you. Okay. Hi, everybody. Welcome to the May CHPRMS Lunch and Learn event. My name is Emma Vogt, and I'm a board member for CHPRMS and the Digital Marketing Director at MUSC Health in Charleston, South Carolina. If you haven't already, please introduce yourself in the chat. And so before we get started with our discussion, I wanted to mention several things. First, we invite you to become a CHPRMS member. We have events like Coffee and Communications, Lunch and Learn, and you'll get access to our member database, networking opportunities, as well as a discounted conference registration. So please visit our brand new website for more information. And that leads me to our annual fall conference. We're celebrating 50 years of CHPRMS. This year, it's happening a little bit earlier in October from the 18th to the 20th, and will take place in downtown Asheville, North Carolina. So we're very excited about that. Registration for the conference is now open, and we hope that you'll go get your tickets soon and take advantage of our early bird discount. And of course, our conference would not be possible without our wonderful, wonderful sponsors. Today, we'd like to highlight Spectrum Reach for all they do to make our events possible. So thank you so much, Spectrum Reach. And of course, you all deserve recognition for all the hard work as well. We invite you to submit nominations for the Wallie and Golden Tusk Awards. This CHPRMS, it's really our way of recognizing all the amazing work our members create. Making those submissions is what today's Lunch and Learn is all about. So now we're going to move on to today's festivities. This afternoon's speakers are the winners of the 2022 Best of Show Golden Tusk Award and are here to walk you through how they found success in the nominating process. From the South Carolina Hospital Association, we have Ship Ames, who is Vice President of Communications and Strategic Marketing. Kathy Sams, who's Communication Consultant for SCHA and its Business Solution Division, Solvent Networks. And Kyle Peterson, Communications Manager at SCHA and a current CHPRMS board member. So Ship, Kathy, Kyle, please take it away. Thank you.
Thanks everybody for coming. Let me get my presentation up real quick. So Wallie's Award presentation success, how to find success in the nomination process. So I wanted to start that I really feel like the process is very similar to the Hollywood Foreign Press. It helps to buy a lot of drinks for board members and whatnot. Yeah, that's my token intro joke. Apologies. But anyway, we're gonna talk a little bit about our how we think about the awards process in general and in CHPRMS and the Wallies specifically, and then walk through a few of the projects that won awards last year, including the Best in Show Golden Tusk, which one of our presenters, Kathy Sams, is the author on that. And then I think Tim is on here as well, who did the layout for that book. But we'll talk more about that in a minute. But first, we want to do some shameless plugs. Since we're South Carolina Hospital Association, and this is a chance for us to connect with our members and partners. So I'm actually going to turn it over to Ship to talk a little bit about H's for hiring just really quickly. And this is both of these are related to our presentation later, so it's not too shameless of a plug. But anyway, Ship, tell them about H's for Heroes, or H's for hiring, excuse me.
Yeah, so hopefully this is a brand that you'll see a good bit more, and you'll notice as we share the stuff that we won for 2022, your work always reflects what's going on in your industry and what you're responding to. So you'll see that a lot of the efforts that we received awards for last year were around COVID and hospital response efforts, and now we're all about workforce. I think just about every hospital and healthcare provider, really every industry is experiencing workforce shortages. We also had a pretty difficult PR campaign against hospitals. I wouldn't really say against hospitals, but didn't put hospitals in the best light over a few years with COVID. So we are doing all we can with H's for Hiring to not only remind folks while they get into healthcare, but help build the pipeline for future healthcare heroes. So maybe this is a bit of a preview. We hope that this will be the content that we're entering for 2023. A lot of content around H's for Heroes and H's for Hiring. SCHA is also taking a lot of credit for this work. And we really want to make sure that we give credit where it's due, and that's also to our Solvent BrandWorks team. This is kind of a little known department within SCHA. It was developed over COVID as we did a rebrand and then realized we needed to step up our communications efforts around everything that was going on. So you'll see there Neil Cameron, who was an acolyte of David Ogilvy, ran that office in the Southeast, went on to Clemson. Kristen does business development. Kathy Sams, who you'll hear from today, she is an amazing strategist and consultant that really helps us vet out a lot of the work that you'll see this year. And then, of course, I think a lot of folks, at least in South Carolina, know Tim Floyd. He has worn a lot of different hats and probably sent you a lot of different hats with logos and things on it. So we're grateful to have a really diverse team here. So I don't just want SCHA to take credit, but also know we have this amazing kind of internal branding company, Solvent BrandWorks, that we launched in 2020 that's really carrying a lot of the weight also.
Kathy, do you want to say a few words about Solvent BrandWorks before we move forward?
I'm sorry, say again.
Did you want to say a few words about Solvent BrandWorks before you move forward?
Yeah, I'm always good for another shameless plug. I think that the Ship's right, the way we started leveraging some of the expertise that we had in-house, such as Neil Cameron and some of the contract work we were already doing with SCHA. And SCHA is still our priority, but we have worked with member hospitals. We've worked with other state hospital associations, other healthcare organizations, and really on a wide variety of projects, from full rebrands to one-off projects like an annual report when somebody just needed some bandwidth and some ideas. And we came in and we're very flexible. If there's any interest in talking with us more, Kristen Hill is your contact there. So love to hear from you.
I thank you, Kathy, for moving forward here, and we'll be hearing from both Ship and Kathy again, and sort of those plugs will make more sense as we move along. But yeah, so about the awards process, and I think I speak for everybody at SCHA, and I think probably it's very similar in your guys' teams, that there's a way in which the awards process can feel a little self-congratulatory and superficial, but there's also a way in which it sort of fundamentally makes you think back to what are you doing well, how are you meeting the strategic vision of your organization, where are our weak spots, how do we understand ourselves in relationship to our industry. So I always think it's a moment of reflection, and then kind of I don't know, just it's I think an important part of how we do our jobs as well. So we're going to break down the awards process in 4 steps. So one, thinking ahead of the awards. So before you even get to the awards table, think about how you're approaching your awards process and how you want that to help and support and drive both the things you're already doing and the things you want to do. And then selecting the right categories. We're not going to do a deep dive into specific Wallie Award categories. We're going to talk a little bit about how to think about what makes the best fit and how to think about where you should be looking for your best ideas for submissions. Then we do the submission process itself. We'll talk about how you dot your I's and cross your T's. Not really, but we'll talk a little bit about some tips about how we did some of our projects from last year and how we thought about the submission process as a way of sort of illustrating that the best practices there. And then bringing your success back to your organization. Again, I think it can read a little cheesy, but we always make a point of going back to our small team at SCHA and talking about what we want and how we feel about it, and making that part of our culture, part of our award-winning communications about how we're proud of our work. And I think that drives us forward into the following year. So yeah. So thinking ahead of the awards process, step 1. And I think this is sort of just a self-examination, recognizing where your organization fits in the larger industry, and then also what areas your team excels in. Because I think this is both how you think about where you're going to fit in the specific categories, but also what are we good at? What is driving our larger theory of the kind of communications we're doing, whether that's marketing on a shoestring budget, doing TV commercials, driving the service, driving up the numbers in a particular service line, whatever it is. I think just that sort of reflection, even before you jump into X category or Y category. I said this a little bit at the top too. What are your organizational goals? What are your team's deliverables in that structure? And I always go back to our SCHA strategic vision, and I like to say, all right, we have all these little projects going on here, there, this initiative, that initiative. How does it feed up to our larger organizational goals, and how are we going to frame it in that context? Because I think our best work always is going to come back to making sure it's meeting that central goal of our strategic vision of our organization, and that should be how we think about what the best awards categories are, best projects to highlight. I think this is also an interesting one, particularly for something like the Wallie Awards. But where do you fit in a particular awards organization that you're submitting for? Obviously, as communications folk at CHPRMS, this is we're healthcare oriented. It's hospitals and nonprofits and what have you. But I think you'd have to think about it differently if you're a hospital approaching, I don't know, like an AAF award or a larger national organization marketing award. You want to think about, all right, what are the specific advantages or differentiators that we have in our industry or in our organization that make more intuitive sense for this particular awards organization. So I always think you shouldn't leave that separate from these other questions. About SCHA and Brand Solid. So you already heard a little bit about both SCHA and Solid Brandworks, but this is just as a way of, as we go into talking about specific awards that we're going to highlight as winners from last year, it's important to know who SCHA and Solid Brandworks are. So I would imagine most of you are familiar with what SCHA does, but we are a trade association. I always like to point out it's a trade association that does member services and advocacy as its sort of primary focuses, but also has the sort of three-legged stool of a nonprofit arm focused on patient safety, population health, and workforce development, and then a for-profit arm as well, of which Solid Brandworks is a subset. And I think we already walked through what Solid Brandworks is already, but we work hand in hand, the SCHA communications team proper and the Solid Brandworks team. So a lot of what you're going to see ahead is a very collaborative process. Reminder, what's a Wallie Award? So Wallie Awards and Golden Tusk Awards, given our annual conference, please come. I would imagine if you're on here, you're planning to submit awards and come. So, but it's worth remembering that a panel of marketing communications professionals from other states choose the winners. So you're going to be, the people who are going to be looking at your work and evaluating are like-minded individuals, although not from our region. And then the competition is open to both hospitals and health systems and providers, but also nonprofits and ad agencies and creative firms. And you'll notice when you submit Wallie for the awards, there are often two tracks for those, because the awards differentiate a little bit, and we like to provide those dual avenues. So you'll want to be aware if those are your competitors in the context of the Wallie Awards. And just real quick, the dates: January 1st, 2022 through July 15th of this year. So you still got time. Navigating the categories. So always just, it's what you always do. What's our best stuff from last year? And I think it always starts with what were your best ideas? What were things you're most excited about? And that's self-evident, but I think it should start there. Making sure it fits the category. And I think it's important, because a great project, doesn't fit, you have to think, at the end of the day, the judge is going to have a set of criteria based on what that category is. So it's always important to sort of reverse engineer it and think about that criteria ahead of time. But I always say the exception also proves the rule. If you have a great project and it doesn't have a good category fit, you still want to give it a shot, because it's your best work. And sometimes that's going to shine through. And because you have like-minded evaluators, they're going to see whatever the logic is, hopefully, that you had when you approached it. But also use the categories to brainstorm. You don't always remember everything you've done in a given year or given time window, but you can use that list to think through and reflect about all the different things you do, particularly if you're in an organization where you wear a lot of different hats. The thing you did back in November isn't always front of mind in July. So I always think that's a helpful process as well. All right, so we're gonna turn it over to Kathy Sams, who wrote a wonderful, lengthy but thoroughly engaging journal, and we actually started this process in the middle of COVID. But I'm gonna let her tell you a little bit more about the process of both creating it all with Tim Floyd, as well as submitting it for the Wallies. So, Kathy, I'll let you take over.
All right, and if you could just advance the slide for me, that'd be great. Yeah, this was I guess one of those projects that it was kind of hard to find the right category for. But we ultimately entered it in the issue and crisis management, and we're very pleased to win there, and also to be rated the best of show. And the way this came about was as the representative for all the hospitals, when the pandemic was first really starting to pick up steam, SCHA was in a pretty unique position to be a two-way conduit of information for hospitals with all those many agencies that were preparing things, and to serve as the voice for hospitals and give them a seat at the table. As is mentioned earlier, Solvent Brandworks took responsibility for the research, the writing, the editing, and design. And SCHA provided access to meetings, documents, and personnel. And I think this was when Brandworks and SCHA communications really, it became hard to figure out where one ended and the other began. We worked together so closely. And I think what's interesting here, and really to the credit of SCHA, is that a couple of things. Even though they were going headlong into, I mean, this was March 2020 when we decided to take this on. And so even though they were just about to run headlong into 24/7 crisis mode, they had the presence of mind and the foresight to say, this is a unique experience. This is once in a lifetime, and we need to document it. And so they did that. And I was the author. Tim Floyd, as Kyle mentioned, was the designer. And we both decided early on we didn't want this to sound or look like a textbook. We wanted it to tell a story in a compelling way. And hopefully we've been able to do that. Like the pandemic, the journal grew in scope and length. It went from a journal article, which we were first envisioning, to finally being published as a 248-page book. I would say that SCHA not only provided access to meetings, they also provided I would not say a free hand, but they provided guidance and oversight and editing and proofing, fact checking, but they didn't censor. And that allowed us to tell a very candid, complete story, including the controversies and the politics. And so what's in that 248 pages are those what SCHA did to respond. there is a timeline that goes over the multi-year period from the first milestone. It's all the events and milestones from that first case that was confirmed in the United States to the end of the public health emergency just a couple of weeks ago. And it is a repository of SCHA's accomplishments. It's a summary of lessons learned. It is a resource for future emergency planning. And I've been told it is a PTSD inducing read because it does go back and really take you through the story. And it's important, I think, because Thornton Kirby, the SCHA CEO, told a board member, said, we were so glad that we did this because we will forget, and we're already forgetting. And I think that's one of the things that that I've heard over and over from SCHA staff members who have read it, said, I forgot we did all that, or I couldn't have told you half of that today. So I think that kind of leads into some of the lessons learned about the takeaways and how we put the award submission together. And Kyle has touched on a few of these, but I think number one is a great award entry starts with a great idea. And it doesn't have to be a life-altering, once-in-a-lifetime, unprecedented event. Any project can, if you let your creative juices flow, you can have a great idea and bring it to life through storytelling and design. You know, that's a challenge, but it's also doable. And that's what's fun about this business. The second thing is to start documenting everything from day one. And I can tell you this, that if we had not started the timeline when we did, it wouldn't exist, because you could not go back and recreate what happened when and in what order and who did what and what was the reaction to that. So we started that and just kept adding to it. And you know, it's important to document your work as you go, to keep a folder, to keep a file, because you won't have time to go back and recreate and look for documents. So if you think this is going to be a big deal, I think I want to make sure we understand, not just for an award, as Kyle said, but for the sake of being able to recreate that process for other projects. If it worked, go back and see, why did it work? What did we do? And I would just finally say to, as you're putting the award submission together, you know, call on your best writing, write persuasively, write for people, write to be read. You know, it's easy to get bogged down into, you know, the details of trying to answer all the questions, and you need to do that, but you also need to tell the story behind the entry. Why did you do it? As Kyle said, what was your goal? Why was this important? And try to get people to feel that when they walk away from it. And I think we you know, certainly had a great idea. I applaud SCHA for starting this process, and then the team that worked together was always available. We got to sit in on all the meetings, and that's important. From if you want to document a process or a major communications project, the communications people need to be in the room. And I applaud SCHA for doing that, and we ended up with I think a great product. And I'll be happy to, I'm gonna turn it over to Ship now, talk about a couple of other projects, and then I guess we'll have time for some questions.
Yeah, so I mentioned earlier that the work you submit is, you know, it's the work that's going to end up in your annual report if you do an annual report. It's the work that you're going to be highlighting in front of your board if you ever have to present in front of a board. And this is that work for us right now. I've mentioned that workforce has really become our top priority. For those of you that have been around SCHA and South Carolina's quality and safety movement over the last decade or so, zero harm has really been our major effort, focused on quality and safety and medical errors being at one point ranked the top 3 cause of death in this country. I can say our board, our members have completely shifted that same enthusiasm towards high reliability into workforce, and trying to not only recruit the next generation, which we talked about with H's for hiring, but also retain this current workforce that is so valuable. Over the course of the Great Resignation, I think healthcare was number 3 number 2 or number 3. I know tech was number 1. It might actually have been number 2 that lost the most workers of folks leaving the industry. And we're starting to see some of those folks come back, but I think every industry is recognizing that we may not reach the workforce levels that we had pre-pandemic at this stage. So H's for Heroes is something that we'll likely be submitting this year. It is our kind of employee of the week recognition program. And it's probably one of our most engaging pieces of content, and we find that that's always the stuff that features the people in your hospitals. Kyle mentioned I was a lobbyist. I was a lobbyist before I went into marketing and communications, and I can tell you that when I used to sit in that lobby, those legislators wanted to talk to people in white coats a lot more than they wanted to talk to people in suits. So that's what we're trying to do, is put our heroes out there, put our white coats out there. And this connects right back to our H's for hiring. We're taking that, really what is if you work in a hospital, that blue H is your most valuable, most recognizable brand property in your repertoire. And it's nationwide, it's global. If you're riding on highways and interstates in America, you know that H stands for healthcare. So we want to make sure that we try and have some appeal, that when people see that sign, we're not just telling you that a hospital is nearby, but we're telling you that heroes are nearby, and we're telling you that opportunities to get hired are nearby. So how much subliminal messaging can we do, and how much can we harness all the value that H already has out in the marketplace? That's what we're working to do with H's for Hiring and with this H's for Heroes effort. Was there a slide after this one?
No, I think that was it for you
Okay.
under H's for hiring. So I did want to say really quickly, just look at the caption there. We populated this by getting photo submissions for our member hospitals and asking them to write little copy that we would use or augment or whatever. So it was a real collaborative effort, and I think it did a great job of sort of looking at the strengths of what SCHA is as a network of our member hospitals. And we said, all right, how do we use the power of that network to create compelling content that is a little bit of a differentiator? And I think just a great example of that.
Yeah, and I'll add real quick, Kyle, also getting back to a couple points that you've made and that Kathy made. If you find something that works, do it. So 100 Faces of Healthcare was a very similar campaign that we did around our centennial anniversary, and it won a Wallie. We really, and quite frankly, it's not just the awards recognition, but it was the most engaging content. People liked, shared, commented. These are their cousins, their colleagues, their friends. It's almost like when you find when you get into a class and you play to the professor. We realize that these types of broad-ranging campaigns that share your people are what get a lot of engagement, and share those analytics too. Those were really helpful with us on 100 Faces of Healthcare, and we've already got over 100,000 engagements on the H's for Heroes campaign, which is all stuff we will include in our submission for an award to help move it up.
That's not to say that our certificate of need content also didn't do a killing on social media.
Yeah, that's probably more in our media relations department.
Yeah. Cool. All right. Let me get this back. All right. So this is the last project we're going to feature. Ship just mentioned we celebrated our centennial back 2020 through 2021. Yeah. And one of the things we got to do as part of that, or decided to do as part of that, was create an hour-long documentary, or 56 minutes and 46 seconds, as my screen is illustrating. And we put it in the special events category for the Wallie Awards. And I think it's a great example of what works as a special event, in that we were really creating a just sort of one-of-a-kind project that, like I said, with the H's for Heroes, sort of took advantage of our position, our network of our members, and then also that wants the centennial, thinking about a sense of history, as well as a partnership with SCTV to create a documentary. And the whole communications team was part of this. Lots of hospitals submitted photos and video, and we worked with the MUSC Warring Library and University of South Carolina history professors. Really kind of tried to do the whole 9 yards with it, and really told the story. It's framed as the 100 years of the Hospital Association, but we tell the larger story of how South Carolina hospitals emerged as an industry and then came to the forefront of the economy of our state too. So sort of making that case as we're sort of threading through what SCHA did and does as time moves forward. So starting as a small trade association and then growing into that for-profit arm, the nonprofit arm, the work on patient safety and population health and things like that. But yeah, I said this is a unique product. Again, takes advantage of who we are and our members, and utilize some of the research skills that both Kathy and I and others, as well as SCTVs had, I think, a 4-person crew working on some of the visual research and stuff too. So really making the most of a partnership to create something special. And yeah, and this is, I think, less about the awards itself, but just as thinking through how you can work with your partners to create unique marketing tools or communications tools and tell larger stories. It's always those larger stories that I think people find most attentive and grab them the most from a marketing perspective. I'm sure you guys have found that in whether it's the copy you've written for marketing or commercial or whatever, that's something that's telling a larger story beyond a simple service line or what have you, tends to have a big impact. And I think that's what sort of touched people about this documentary. We made a big deal, of course, of this. This was still in the middle of COVID, believe it or not. So we had talked about having this sort of big shindig affair and running out of theater and all that, but we ultimately did a small premiere party with our SCHA board. But we kind of did it up a little bit. Tim Floyd made some sidewalk stars for the principal subjects of the documentary, and create a little program and stuff like that. So really kind of made that also special too, and then gave that as a memory. And then, but it also got premiered. I think, wish I had the exact day. I want to say like December 28th, maybe, of 2021. But then ran multiple times on CTV and is still available for streaming. And is now a depository for that research and storytelling as well. But I think the fact of that partnership, getting it across all the screens and on the statewide television network, as well as our own promotion for it, is probably what gave it a sort of 360 special event feel that made it really meet the criteria of the award in the category. Still quite proud of that work. We're on the last slide now. Remember to celebrate. Like I said at the top, I do think this is a part of the award process. Making sure that it actually means something after you leave CHPRMS and are recovering from the after party and whatnot, that you go back and celebrate with your team and with your organization, and making sure that award-winning nature and that success is celebrated and is embedded in your culture. I know hospitals know and talk about all the time that the culture of the workforce is so important, and awards can be part of that. Let me see. Let's do fancy. Yeah, so building a team culture, I think first and foremost, it's I think a big part of why SCHA is trying to put together a group of people to go to CHPRMS each year, is to make sure that we have that in mind, and we're not thinking about that throughout the year, but like letting that sort of success imbue the work throughout the year, and thinking through, we want to make the best work we can. Excellence mindset, yeah. So it's one of the things that I think about a lot, is trying to make everything you do the very best you can do, and it can be tough sometimes in the slog of the day to do that, but having that, like as Tim said, that little folder on your desktop for awards, keeping that sort of in the back of your mind, that you want to do the best work as possible. That means you're going to meet your objectives for your organization better. You're going to meet your personal objectives. Your employee reviews are all going to be better. So I think it's okay to let the awards drive that and let that sort of, be imbued in your mindset. Because they good for quants views. And yeah, what time is it? I think we're done a little bit early, but I did this maybe a better than average sort of possible Q&A. Tim threw a couple of ideas in there about how to celebrate awards, and I'm sure some of us how to approach the award submission process. And I'd love to hear from you all as well. And because I think everybody's got a different practice that we can all bite from. So yeah, if there's any questions, please either toss them in the chat or you can as well.
Thank you guys so much. And definitely, if you have any questions, please feel free to raise your hand or speak up or enter them directly into the chat. And I know I have a couple of questions. So when you guys are choosing topics, how many do you typically submit? Do you try to limit the amount and like choose key category areas, or kind of what's your approach strategically to submissions?
Here, I can help with that one a little bit, Kyle. So one, we've been a little cash strapped, and SCHA has generally been a sponsor of CHPRMS. So one of our strategies actually last year was to submit for more awards than we have in the past. So we could find, it was like a lot of hospitals and healthcare systems, we have a hard time getting travel and certain things approved. So rather than work this another way, or rather than give money directly to CHPRMS, which was hard for me to get an approval, we've submitted for 5 or 6 awards, or excuse me, for about 6 awards. And it's sometimes, we're not going to be able to check every box for every single category. So it really is finding those crown jewels. I will say we benefited from our centennial. Anytime that you have a big event like that, I think it's going to force you to churn out some pretty awesome content. It really is. What is when we look at what we're going to share, what are we planning on sharing in our annual report this year? What has been our board directives? What has been our big mission objectives from the organization? And then really what has gotten the most engagement, whether that's in your newsletter or on social media. We try to not only pick the best performing stuff, but also the stuff that is under our mission and that's really driving our work.
Terrific. We have another question in the chat, which is a good question, and I kind of have follow-up on that as well. But what do you guys find is the best way to submit with no quantitative data?
I'll take that real quick. I feel like that I kind of touched on that a little implicitly in talking about the documentary, because as much as we had the numbers of screenings and things like that, we didn't have the Nelson data for the numbers. I always think it's sort of making a case of setting up your own goalpost, right? So saying what were you trying to accomplish? How did you read that as being successful? And that doesn't necessarily mean hard quantitative data. But I do think that also comes back to the categories a little bit. Certain categories, like I think social media, because the analytics should be right there at your fingertips, and that should be part of how you judge your success. You have to have the data. But other things, I think the demonstration just could be in the sort of the success of what you set out to do. Did you accomplish it? So sort of establishing your own goalposts, even though there's a limit to that, but I think that's the way I would approach it. Kathy or Ship, do you have thoughts?
I just threw a note into the chat about qualitative data is not a bad thing. We if you got letters or emails or comments from some of your important constituents, your C-suite or patients, whoever your target audience was, and what it meant to them, that can be very helpful. I mean, one of the things we did was include some of those quotes that I mentioned earlier, like I had forgotten we did half that. And when our board chair, the solvent board chair, we were making a presentation and they're all looking at the proof, which at that time had so many errors in it. I was just like dying over in the corner about, because it had not been thoroughly proofed. But anyway, they were still impressed. And the chairman said, this was a spectacularly good idea. I wrote that down, you know, so I think you really just need to think a little bit broader. There's some, it goes back to what Kyle was saying, it's the entry. Some of them demand quantitative data. And we also always use a very research oriented, you know, if we have some data, we will include that. But I think it's also good to think about, well, what impact did it have on the people you were trying to reach?
And I will say, somebody had asked too about who judges the other submissions, and I've actually I've judged for NESHCO a couple of years in a row here, and just speaking a little bit to that experience and whatever, is just that the quality of the work is what's going to drive the judge. And I think there's, at least for me, when I'm judging, there is a tad bit of leniency when I know there's a good idea, good execution there. But again, it comes back to that goalpost, because you're going to have a section in criteria about, did you set out to what you achieved? Did you do what you set out to achieve? And can you demonstrate that that was a success? And there has to be something compelling there, but it doesn't, like Kathy just said, it doesn't always have to be pure quantitative data. It just has to be, it has to, you know, complete the loop basically from idea and implementation to successful conclusion. But the quality of the work, I think, does shine through, and then the judge will lean towards the work that where it has the good idea and good execution. So.
Along those lines, when you're doing your submission, I feel like it's so important to do it the right way and include the right information. How do you guys kind of narrow down what you include with your nomination? And if you do have a campaign where there are metrics and data, how do you choose what's the most relevant and important to include?
Chip, you're on mute.
Sorry, just realized I was muted, John. You would think that I have this down by now. You know, generally when it comes to the analytics, you're really only going to have that on social media. You're going to have that around website SEO and how many hits you got. So, you know, anytime that we are sharing kind of a toolkit that might include social media as well as a website, as well as, you know, different types of media pieces, then we certainly share analytics on, you know, hits, on engagement, on shares, on people reached. But really, when it gets to a lot of the qualitative pieces, you know, I almost want to call it a novel, but it's got so many pictures in it. The journal that Kathy wrote, you know, the last thing I wanted to do was have a 2-page synopsis of that journal, because good Lord, whoever was going to sit down and read that journal and judge that journal, they had their work cut out for them. So, you know, a lot of my times, you know, because Kathy and I have kind of tag team filling these out with help from the communications team. A lot of the times we're trying to really focus as much as we can on giving a very brief overview of that piece to ensure that we get a lot of time spent on the piece where we did a lot of work. So if it's that quantitative data, then we're certainly pulling as much as we can from social media. But on the qualitative data, like Kyle said, I like to just say, what was our goal here? So our goal was to document the COVID-19 journal, to share lessons learned and best practices should this ever happen again. Our goal was not to be a national bestseller with that book. You know, it's like Kyle said, it's about the right framing, making sure you have the quantitative data if you're going to talk about digital campaigns and have those metrics. And then, quite frankly, if you have a really big piece that's really going to be focused on aesthetic and design, I try and let that piece speak for itself rather than spend too much time on the description, because I'm very grateful for the person who's judging it.
Are there any other questions in the chat? Looking to see if I missed anything. Is there any other tips that you guys would have for somebody who's not submitted before, hasn't attended the event, in just their selection? Like top tip you'd want to give them?
I don't know. Again, I think this is a tad simplistic, but I do think it matters. Is well, what are you excited about? You know, I mean, I think when you hear us talk, hopefully it comes through when we're talking about these projects. We're still excited about them. Are kind of old now. They feel like year and a half, 2-year-old projects in a lot of ways. But it's what you're enthusiastic about. That's gonna drive home, even if I think sometimes the submission process itself can feel a little bit like a grind, particularly like me, you haven't quite kept the folder like Tim does, where you're having to sort of do some stuff you should have done at the beginning there. But it is the stuff at the end of the day, I think, that you were enthusiastic about and still are, that will be your best bet.
And I guess my other tip would be, don't let the awards entry deadline slip up on you. I mean, I think SHPRMS does a good job of getting information out in advance, and yet there's still this tendency to think, I've got a lot of time to think about that. I would go ahead, and when you see that first one, I would put the deadline on my calendar, and then I would back up from there and start figuring out when I need to work on the submission. Nobody's got enough time. I mean, I've yet to talk to someone who says, I don't know what I'm going to do this week. I just don't have anything to do. And I know there's nobody like that on this call. So I think you just have to make it a priority, and not, I think as we've tried to say over and over, it's not just about winning an award. It's about recognizing good work, creating some sense of pride and ownership within your organization, and finding some things that will give you good ideas for the future. But it's also just, you just got to do it. You just got to find time and do it.
Yeah, and I would just piggyback on Kyle saying, submit the stuff you're excited about, but submit the stuff you've worked the most on. Submit the stuff that you spent the most time on. We're about to spend 2 months trying to educate Medicaid beneficiaries on the likelihood that they lost their benefits because the public health emergency is over. That is not sexy content. That is not like content that the rest of the world is like, oh my gosh, this is beautiful. But this is the place to have content like that recognized. So, I know that we don't always work on the most cutting edge pieces in healthcare, and we're not always really on the edge of the world of marketing. But don't let that dissuade you from putting anything out there. If you've spent time on it and you're proud of it, then there's probably going to be somebody in this network that understands and identifies with it.
I love it. That's great advice. Do you guys have anything else you would like to add before we wrap up?
I was very serious about buying the board members free drinks. No, I'm just kidding.
I love it.
Just thank you to SHPRMS and the board for all you do. It's a lot of work. I know. I've been there.
Thanks for giving us a venue to have things like Medicaid redeterminations recognized.
All right. Well, thank you guys so much. That's all we have today for our Lunch and Learn event. Again, I want to thank you guys so much, our presenters, Chip, Kathy, and Kyle, for your expertise on this. I just want to add that this year, we've actually extended the range of time with which you can enter. Entries are eligible if they've run between January 2022 through July 2023. And new this year, we've actually added a category for research. And lastly, we're happy to say that the entry pieces have not changed, or the entry prices have not changed from last year's pricing. So we have a coffee and communications event coming up on June 16th with a panel of communicators who will discuss messaging for recruitment and retention. Look out for details on that from our social media channels and our website. And if you've enjoyed today's discussion, please consider becoming a member of CHPRMS. And thank you all so much for attending today, and have a great Wednesday. Thank you guys so much. Bye, everyone.
Thank you all. Bye.